convening. This year, it will be held from the 22nd to the 25th of October in Durban, South Africa, under the theme Moving Towards Self-Reliance to Achieve Universal Health Coverage and Health Security in Africa. The conference is co-hosted by the Africa CDC and the Government of South Africa in collaboration with Africa Bio's 8th Annual Bio-Africa Convention. CPHIA brings together governments, public health institutions, scientists, innovators, civil society, and youth, all united around one goal, that is building a healthier, more resilient Africa. We are privileged to be joined by three distinguished leaders who represent science, policy, and innovation. Professor Olive Shisana is the co-chair of CPHIA 2025 and president and CEO of Evidence-Based Solutions. She's also a renowned researcher and policy expert with decades of experience in health system strengthening and universal health coverage. Professor Shisana as well has served as a social policy advisor to President Cyril Ramaphosa, led South Africa's work on national health insurance, and co-chaired the ACT Accelerator to ensure equitable access to COVID-19 tools globally. We are also joined by Dr. Nala Msomi, the president of Africa Bio. He is a biotechnologist, innovator, and entrepreneur, currently serving as the Director of Innovation and Commercialization at the University of KwaZulu-Natal. Dr. Msomi has also worked across research, academia, and policy, championing biotechnology and innovation as engines of Africa's health and economic transformation. And lastly, we are also joined by His Excellency Dr. Jean Kaseya, the Director General of Africa CDC. Appointed in 2023, Dr. Kaseya is a physician and epidemiologist with over 25 years of public health experience. He leads Africa CDC's vision for a new public health order, focusing on health sovereignty, sustainable financing, and stronger epidemic preparedness across all 55 Africa Union member states. A warm welcome to our speakers for this session, and once again, we apologize for the late start. We start off with an overview of CPHIA 2025, where we gain an idea of the context, objectives, and key themes or program highlights. I will now welcome to the floor Professor Olive Shisana, the CPHIA 2025 co-chair, president and CEO of Evidence-Based Solutions. Over to you, Prof.
Members of the media, distinguished guests, and partners in public health. Today marks the official launch of the 2025 Conference on Public Health in Africa, CPHIA. It could not come at a more critical time. CPHIA 2025 is Africa's flagship public health convening, co-hosted as indicated earlier by the Africa Centers for Disease Control and Prevention, the Government of South Africa, in collaboration with Africa Bio's 8th Annual Bio-Africa Convention. Africa is facing a surge in outbreaks, a decline in aid, and health system pushed to their limits. However, this moment is not just a crisis, it is an opportunity for Africa to lead, shape, and define its own health future. CPHIA 2025 is more than a conference. It's a platform for Africa to reclaim its leadership in global health. It is where shared crises become shared opportunities. And it is where Africa's voice, rooted in evidence, experience, and innovation, takes its rightful place at the center of global health decision-making. Hosted here in South Africa, CPHIA 2025 reflects the same spirit that drives our G20 presidency, that Africa must shape the global health agenda. The theme for this year's conference, which has been said earlier, is moving towards self-reliance to achieve universal health coverage and health security in Africa. What it does, it speaks directly to the urgency of our time. Self-reliance is not isolation, it is resilience. It is about harnessing our own capacity, investing in our own systems, and ensuring that Africa's priorities drive global health decisions. The program is built around three core pillars that translate policy into action. First, primary healthcare transformation. That is strengthening the backbone of our health systems. Secondly, predictable health financing. securing sustainable resources for long-term impact on the health of our populations. And third, local manufacturing, that is scaling up production of vaccines, medicines, and diagnostics to reduce reliance on imports. These pillars are explored through 8 dynamic tracks, ranging from health product manufacturing and financing innovation to digital health, climate resilience, and pandemic preparedness. Each track complements South Africa's G20 health priorities and amplifies Africa's leadership on key global issues. The evidence and policy recommendations generated here will inform the G20 Leaders Declaration later this year. The Scientific Program Committee has worked tirelessly with experts across the continent to shape a program that is rooted in African priorities. These sessions will feature voices from across Africa, that is the scientists, the policymakers, and communities, ensuring that what we discuss is inclusive, relevant, and actionable. CPHIA has become Africa's premier platform for advancing health sovereignty. And this year, it takes on even greater significance. Just weeks from now, South Africa will host both the G20 summit as well as the Global Fund's aid replenishment. Health financing and equity will be central to those negotiations. CPHIA 2025 is our staging ground. It is where we consolidate Africa's common positions, showcase what works, and accelerate the partnerships that unlock progress. The African Union, through Africa CDC, serves as the political and technical anchor of this conference. Africa CDC will leverage insights from CPHIA to inform the AU's contribution to the G20 Health Working Group and the Leaders' Declaration. Hosting CPHIA in South Africa ensures a direct bridge between continental evidence and global policymaking, transforming Africa's health priorities into global commitments. So why South Africa and why now? Because South Africa's dual role as CPHIA host and G20 chair gives us a unique opportunity to project Africa's health priorities globally. South Africa stands as both a symbol of progress through our universal health coverage reforms and manufacturing leadership, and a strategic bridge connecting Africa's priorities to global action. Let me close with this. This is Africa's moment, a moment to chart a path towards health security and universal coverage. CPHIA 2025 is not just a conference, it's a launch pad for solutions that will make our system stronger, fairer, and future ready. Thank you very much for your attention.
Thank you very much, Professor Shishana. I will now welcome Dr. Nala Msomi, the President of Africa Bio. Over to you.
Thank you, Your Excellency, Dr. Kisaya, and the dignitaries. A little bit about BioAfrica, which is celebrating its 8th year of existence this year. And we're very grateful for the partnership with Africa CDC. Perhaps it helps to just give a brief background on why BioAfrica. BioAfrica started about 9 years ago, and the aim of BioAfrica was, and it continues to be, to build from the ground up the scientific capability in the continent, and to see how we could craft, as scientists in the continent and innovators in the continent, a global South innovation model that will influence how the value chains from an industrialization perspective are organized. We recognize that the government has a role to play, as well as multilateral bodies. But unless African scientists themselves and African innovators themselves are part of that partnership, nothing is going to move. We will continue to import solutions from the global north. That is the basis of BioAfrica from the get-go, from when we launched it about 9 years ago, to try and find a platform and define a platform that will be directed by Africans for Africans, including those in the diaspora. One of the highlights of partnering with Africa CDC this year is around a project that we've started putting together again, going back to doing it for ourselves, not just paying lip service to that, but also doing it, is we are launching hopefully what would be a model for an African defined agenda for pharmaceutical development. We noticed most of the people that drive Africa Bio and BioAfrica come from the lab. So they're innovators. Most of us are scientists by training, one way or the other. And we've noticed this disjuncture between the science and the industrialization part. And that a lot of the challenges that the continent has is due to the fact that at the end of the day, the agenda is controlled by big pharma or big industrialists. And that even those companies that are in Africa do not carry an agenda that is helpful to Africa because they import technologies, whether through technology transfer and all of that. So we are not, and we're mindful of the fact that ours is a commitment to a long-term vision where innovation will happen in Africa, will be dictated by Africans, and will address problems that occur in Africa. I read or had a meeting a few weeks ago somewhere where there are at least 200 epidemics happening across the continent at any point in time, the majority of which do not have countermeasures, whether it's diagnostics or pharmaceuticals. And part of the reason is that those who control the global innovation agenda have no interest in it for commercial reasons or even for scientific reasons. And that is what we hope to offer as BioAfrica and what we've been trying to create over the past 7 years or 8 years. This is our eighth BioAfrica, and it's growing. And we're very grateful to Africa CDC for reaching out to BioAfrica so that we can jointly reimagine together with other stakeholders. We can reimagine a future that is driven by African scientists, that is driven by African innovators as opposed to the scientists, and that is also going to, in a different way, force the industrialists in Africa to look at the game in a different way, in a manner that serves Africa's needs in the public health space. Thank you.
Thank you very much, Dr. Msomi. I will now hand over the floor to His Excellency Dr. John Kaseya for his keynote insight on transforming health financing and advancing self-reliance. Over to you, Dr. Kaseya.
Thank you so much, Margaret. My sister, Professor Olive Chisana, co-chair of CPHIA 2025, and my brother, Dr. Nala Nsomi, president of Africa Bio. Thank you so much for joining us today. I thank also our colleagues from the media who are covering this launch today. We meet today at a decisive moment for the future of health in Africa. Across this continent that we love, health systems are under pressure like never before. Outbreaks of infectious diseases are rising sharply, up by more than 40% in just 2 years. Climate shocks, from flood to drought, are disrupting lives and strengthening and straining already fragile systems. Conflicts are displacing families and placing entire communities beyond the reach of care. But perhaps most worrying is that these crises are unfolding against a backdrop of declining resources. Since 2021, foreign assistance for health in Africa has dropped by nearly 70%. It means hospitals without essential supplies, communities left without clinics, health workers losing their jobs. It also means the hard-won progress that we made on maternal and child health, on HIV, on malaria, on non-communicable diseases all of that is at risk of being rolled back. This is a turning point. Africa cannot afford to continue with business as usual. We must rethink how we finance, manage, and deliver healthcare. We must rebuild the systems that are strong, resilient, and above all, self-sufficient. This is what we call the health sovereignty in Africa. This is why the upcoming CPHIA 2025 is not only important but critical. It's not just another meeting. It's seeing Africa honing this platform to shape the Africa health future. In Durban, leaders, scientists, policymakers, and community voices will gather to forge solutions that work for Africa. The conference will spotlight African ideas, transforming primary health care, creating sustainable financing, scaling local production of vaccine, medicines, diagnostics, and other commodities. And above all, CPHIA will be about action. Commitment must lead to result. Strategies must translate into stronger systems. Declarations must save lives. One of the most urgent areas we will address is health financing. The numbers speak clearly. While aid has collapsed, many African countries are burdened with shrinking fiscal space and rising debt cost. But we are not powerless. Across the continent, governments are taking strong, bold actions. The Accra initiative, complementing the Africa Health Financing in the New Era, launched by Africa CDC, are clearly showing a pathway towards sustainable financing of health. At Africa CDC, we are working hand in hand with government to accelerate this shift from dependency to self-sufficiency. Our strategy on health financing for sustainable health systems is helping member states to revise their national financing plans, to test innovative models, to mobilize new resources. These reforms are country-led, grounded in national priorities, and supported regionally. They are about ensuring that Africa has the financial space and the systems to guarantee universal health coverage. Dear colleagues, let me be clear. Financing is not just about money. It's about justice, about equity. It's also about governance. Today, too many women are paying more for healthcare out of their own pockets, often at the expense of feeding their families or educating their children. They don't have to make this choice. Financing reform must be gender responsive so that women are not left behind, but instead empowered as leaders and the beneficiaries of stronger health systems. We are also exploring bold innovations, health taxes that ensure sustainable revenues, diaspora bonds that tap into the pride and solidarity of Africans abroad, blended financing that leverage private capital and result-based model that reward measurable outcomes. As we insist on one guiding principle, every dollar for health in Africa must go further, must be aligned with national priorities, and must deliver real impact. Equal urgent is the question of sovereignty in health product. As we know, Africa still imports 90% of our medicines and vaccines. During the COVID-19, Mpox, Ebola, Marburg outbreaks, we experienced this reality. This cannot be our future. We have begun to turn the tide. African scientists are developing solutions tailored to our context. And we also put in place the African Medicine Agency to regulate the process in Africa. We also have our African pool procurement mechanism that will help to ensure that all African countries, irrespective of their population, economic status, can have access to quality and affordable health commodities. But this is not only what we are saying. This is the beginning of a strong action to truly safeguard the health of 1.4 billion Africans. We must scale up manufacturing hubs. We need to strengthen regional supply chains and create markets that reward African production. Every factory that produces vaccines, diagnostics, or medicines in Africa is not only saving lives, it's creating jobs, building economies, reducing the dependence to others, and becoming even the factor for peace and security. This is why in Africa CDC, we call local manufacturing the second independence of Africa. Africa's challenges are indeed complex, but our solutions are within reach. We have the leadership, we have the talent, we have the determination. Our task now is to convert this momentum into lasting change. This is why CPHIA 2025 is such a pivotal moment. It will be held in Durban, co-hosted by the government of South Africa under its G20 presidency. There is no other place in Africa where we can organize that if it's not South Africa. I want to thank South Africa for its leadership and also acknowledge Africa Bio, the country's flagship life science and innovation platform. Both of them decided to collaborate with Africa CDC for the CPHIA 2025, and we feel honored. The timing of this conference is deliberate. It takes place just a few days before the G20 Health Ministers and Leaders meeting. That means Africa's solution, grounded in solidarity and shared responsibility, will directly feed into the global health agenda at the highest level. Colleagues, CPHIA 2025 is a call to action, a call to align our voices, to act with urgency, and to accelerate progress. It's a major opportunity to show that Africa will no longer be a passive recipient of global health policy, but an active one, an active architect of its own destiny. We think we'll seize this moment to finance our future, to manufacture our solutions, and to safeguard the health and dignity of every African, but also every citizen in this world. We need to come together to transform this turning point into a defining moment for Africa health sovereignty. I thank you.
Thank you very much, DG, for your keynote address. We're now moving on to the Q&A session. We invite all the journalists to use the raise hand function on the Zoom platform to raise your hand if you have any questions. I will now take the first two questions here. I have one question for Dr. Shisana. The question is, what do you expect to be the primary outcomes of the G20 discussions on health responses and outcomes in Africa? And how will CPHIA contribute? Dr. Shisana?
Okay. Thank you very much for the question that you have asked. Obviously, there are discussions that are going on, and ministers are going to be meeting and engaging, and only after they have engaged will they be able to make a clear position. But we do know that CPHIA 2025 is going to showcase those innovations already making a difference on the ground. They will be exploring how these solutions can be scaled across the continent. And they will also accelerate partnerships that unlock progress for a safer and healthier Africa. Furthermore, they will be able to support and translate national and regional initiatives into action. In other words, all of these things are going to provide evidence and policy recommendations that will inform the global platforms, in particular the G20 itself. So I am convinced that this meeting is going to make a big difference insofar as adding to the health ministers meeting, and then those recommendations will then be taken forward to the G20 as part and parcel of the AU contribution, to the whole concern that we all have in Africa, ensuring that we've got our own skills, our own resources to be able to address the problems that we have in Africa.
Thank you very much, Professor Shisana. I now have a second question here for Dr. Msomi. What is the direct role of local initiatives and local knowledge in health outcomes in Africa? And how will CPHIA refine this? Back to you, Dr. Msomi.
Thank you for that question. I think one of the mistakes or misconceptions we have is to overlook the fact that most innovations that eventually become global or dominant products globally started somewhere, some locality, some small place, usually in the global north, and then it is replicated across the world. Where we sit as Africa Bio or Bio Africa, we think that there's still a big role for innovations that emanate out of Africa, because innovations are driven by a couple of things. But the two things that I want to emphasize is that you have to have the intellectual capital, which I think Africa is well poised. We have been producing, our continent is full of young people. They have the talent, and that's what's always driven innovation. Global innovations, whether it's in quantum technologies, in AI, or in the previous technologies and healthcare, are based on the intellectual capital that comes out of the institutions. That's one. The second part, which I think the Africa CDC has been addressing, is the issue that innovations, once they have germinated, they have to be pulled into the clinic by the market. And I think the procurement mechanism that is being set up is going to be an important driver of pulling these innovations into the clinic. And it's very, very important to re-emphasize that innovations are by definition a result of the conditions where the science and innovation is happening. If the science and innovation is not happening in a place where there is, let's call it an Ebola that's endemic, or Mpox that the teacher spoke about, and whatever, you are not likely to get those into the clinics. And I think that's the hope we have in moving forward. And we are very, very hopeful and grateful for this partnership, because between Africa CDC, the CPHIA, and BioAfrica, and hopefully others that will join in this agenda to drive the agenda of innovation for healthcare, for universal healthcare in Africa, we can then start to move the needle forward, one way or the other. It's been the case in other settings, in the global south and in the global north. Thank you.
Thank you, Dr. Msomi. The next question goes to Dr. Kaseya. Dr. Kaseya, you mentioned that health financing will be a key focus at CPHIA. What specific financing reforms or models will be discussed to ensure sustainable health systems in Africa? Over to you, DG.
Thank you so much. When we are talking about the reform of health financing in Africa, it's about money, it's about governance. About money, we are mostly talking about domestic resources. It's time for Africa to start to say, let us finance our health system. We still have an average of 7% coming from government for the health sector in Africa, far from the 15% of the Abuja Declaration. We still have countries in Africa today providing less than 3% to their own health system. How can you build a resilient system without providing funding and just waiting for external support? But because we know the fiscal space cannot accommodate many countries to do that, we are coming with some innovative solutions. That solutions are already implemented in a number of countries, including South Africa, including DRC, Ghana, and so many other countries. It means thinking about some taxes, any kind of taxes, sugar, tobacco, airline, any kind of taxes that can help to get more funding for the health system. DRC was informing me by allocating 2% of all goods imported to this country. The health sector is getting around $1.4 billion additional every year. This is how we can innovate to bring more resources. But we need in Africa to change, to have the private sector playing a key role. This is the third source of funding, blended finance. This money coming from private sector for investment. But if you have money, you need to make sure that you have governance. We are saying, we are advocating for zero fraud and corruption in the health sector in Africa. Because from one side, we are creating resources. From another one, we don't want these resources to disappear. This is why we are calling our ministers, our leaders, our communities to come together and to put in place, depending on the context of each country, mechanisms that can support good governance, that can lead for less corruption and zero fraud. This is the agenda that we'll discuss during the CPHIA. Thank you.
Thank you, DG. Let's cross over to the floor. We have Kemo Cham from Mano Reporters. Kemo, you have the floor. Kemo, can you hear us? All right, let's check.
Okay, so I'm just trying to tap my thoughts off because I'm on the highway now. If you can read that.
Sorry, Kemo, can you go again? We didn't hear you.
I said I just tried to type my question.
Oh, all right.
On the highway and it's noisy here.
Great. Okay, we'll get to your question. Thank you. Let's get the next question. Abuja Rachel. Abuja is works with the news agency of Nigeria. Abuja, you have the floor.
Thank you very much.
Yes, we can hear you.
Hello. Thank you so very much. Okay. My question is for Dr. Keziah. He made mention of Doctor, you emphasize that Africa cannot afford business as usual. What are the key priorities for African CDC in mobilizing sustainable domestic financing for health security? Now, with donor funding dropping by almost 70%, how can African government close the gap, and what innovative financing model is African CDC promoting? Thank you very much, and over.
Thank you. Back to you, DG, for the response. You are on mute, DG.
Sorry. What was not possible a few years ago becomes possible today. African countries were depending, if you see almost how Africa is funding the health system, it's out of pocket. It means people paying by themselves. That represents around 30 to 35%, depending on countries. Then you have external resources, what we call the official development assistance. That also, depending on countries, is around 30 to 35%. And then you have the budget provided by the government. That is many times less than 15%. This is almost how the financing of health system in Africa was. I have to say was. Now, the ODA going down, the two sources that remain are out of pocket and the health budget from the government. But out of pocket, it means people were already poor. They have to pay more without thinking if they can have food, if they can educate their children, if they can have access to other services, even without knowing where this money will come from. Out of pocket is not a solution. What are solutions that Africa CDC is putting, suggesting? First, to ensure that we have in place what we call the community health insurance. The example of Rwanda, the example of Ghana are leading us to say this is possible in Africa. Around 10% of people had health insurance in Rwanda during genocide time. Today, we have more than 80% of people paying less than $2 per month, having access to all kinds of support. This is the first one, the first area to reduce out of pocket. The second area is what I explained, these three approaches: domestic resources, innovative financing, blended finance, to increase the ability of the government to have more funding for the system. Then, when you have the health insurance, when you have more money coming, we need a strong digital system. This is the third action that we are promoting, to digitalize the health system in Africa. That will help, like in Kenya, using the mobile phone for mobile money to cut the fraud and corruption. And yes, we are thinking also to build systems that are promoting strong governance. These are some actions that Africa CDC is promoting, linked to decisions made by our leaders during the AU Assembly to ensure that Africa can be out of that. Believe me, countries that started to experience that are showing the success of this action. Thank you.
Thank you, DG. Let's take the next question. We have Chioma. Chioma, you have the floor.
Hi, good afternoon. Can you hear me?
Yes.
Okay, so my name is Chioma Namani and I work with Africa Health Watch. And my question is generally to the organizers of the conference. So I want to know, participants from outside South Africa are facing challenges securing visa appointments. So in my case, I'm supposed to be attending from Nigeria, and the earliest available date for a visa interview is on the 21st, which is a day before the conference begins. So I want to know if the organizers are aware of this, and if there is a plan for visa facilitation, maybe official letters or engagement with the South African authorities to help participants and make sure that delegates from across Africa are actually fully represented? Thank you.
Thank you very much. Let me call upon Dr. Elvis. He's co-chairing the Secretariat. Dr. Elvis, if you can hear us, could take the question.
Good afternoon, esteemed colleagues online. Good afternoon, Margaret. Thank you for the question. So with respect to the visa, yes, we understand the challenges that may be associated with visa. So one of the key things that we are requesting from the participants is that when you make the decision of attending, please kindly register so that we provide to you the visa application letter. This information is also very important because we are sharing it directly with the colleagues on the ground in South Africa, who are going to use this information to inform the different missions in the different countries that delegates will be coming to apply for visa. So please kindly register so that we can see how we can facilitate this process. Thank you very much.
Thank you, Dr. Elvis. Let's take the next question. I have one here for Dr. Shisana. The question is, you hinted at South Africa being a key manufacturer of health products. How is the country looking to advance local manufacturing of such products, bearing in mind that Africa makes less than 2% of the vaccines used on the continent? Dr. Shisana?
Okay. Now, thank you very much for the question. The aim for South Africa is to continuously support the work that is currently going on with regard to the mRNA vaccine, for example, that has been produced, in South Africa. That is the first one that has been developed in Africa. And working together with Egypt, for example, it will be possible to be able to share the information. For example, if you look at the situation of mRNA, we have an end-to-end mRNA vaccine production platform already, and is going to be built and strengthened across Africa to produce 100 million doses annually. That is what our target is. But that partnership is going to include the Eva Pharma in Egypt and the European biotech firms. So the collaboration that is going to be taking place between biogeneric pharma in Egypt and Afrigen in South Africa will expand the development of mRNA vaccine technology so that it can really reinforce continental expertise in these particular areas. So I'm very happy about that. But at the same time, we do want Africa to accelerate the African pool procurement mechanism so that the vaccines that are produced can actually be sold within the continent and outside of the continent. Because if we do that and invest in harmonized regulatory frameworks across the continent, we are likely to ensure quality, scale, and sustainability.
Thank you very much, Prof. Let's cross back to the floor. We have Linda Na. Linda is from the Ghana News Agency. Linda, you have the floor. Linda, can you hear us?
Hi, everyone. Hello.
Hello, Linda, can you hear us?
Yes, I can hear you. Can you hear me too?
Yes, go ahead.
Okay. So, my name is Nadege. I joined from Accra, representing the Ghana News Agency. Not long ago, Accra hosted the African Health Sovereignty Summit. And the discussions were no different from what we are discussing here today. The WHO Director General mentioned that Africa needs fair trade terms to be able to ensure that our journey towards health sovereignty becomes possible. Now, I want to know from the speakers here, I want to know what practical steps can we take as a continent to ensure that the local pharmaceutical and vaccine manufacturing systems are working well to our benefit, and we are not relying on imports. And also about the upcoming conference, I want to know What's different you would be doing apart from the usual like conference that we have, the talk shows and all that? What difference should we expect from the upcoming conference, and what practical measures do we expect taken at the end of the entire process?
Thank you very much, Linda. Let me just repeat the question. It was a bit muffled. So the first question she's asking is practical steps to ensure local and vaccine manufacturing systems are working well within the continent. I think Dr. Kaseya can take that. And then the second question is on what is different this time in terms of the CPHIA conference in regards to the other conferences that are held on the continent as well. Dr. Kaseya, over to you.
Thank you so much. Regarding local manufacturing, we don't have choice. I think Professor Chisana was explaining the progress we are making. You know, it's not just about health security. It's also about economic growth, job creation. We are talking about a market that will be around $240 billion in the next 15 years. $240 billion annually. For Africa to capture these resources, to build our industry, to create jobs, we need to make sure that we are serious with the agenda of local manufacturing. It means clearly, first, we need to support research and development where it's possible, like in South Africa. Where it's not possible, we need to have what we call the transfer of technology. This is critical for us to start thinking about manufacturing. We also need financing. We already secured $1.2 billion with Gavi under African Vaccine Manufacturer Accelerator, AVMA. We secured $2 billion from Afreximbank. We secured $1 billion from European Union and so other partners to ensure that our manufacturers can have access to funding to manufacture the product. Then we need a strong capacity building because we need to have people trained to do what they need to do. And of course, the regulatory aspect is a critical one. Today, we are celebrating 9 countries with the National Regulatory Authority at maturity level 3. Ethiopia was the last one a few days ago. But we need also to see the African Medicine Agency coming strongly. And this is also our goal, to ensure that all African countries, they accept and they approve AMA under their policies to operationalize that. The last one is about market. Market means demand creation, because we are talking about 1.4 billion people. We are talking about Africa CC working together with FCFTA to avoid the trade barriers. It means also supporting the African pool procurement mechanism as a way to secure quality products that are affordable for our system. This is all components that will make the local manufacturing moving. Quickly, maybe my colleagues, they will also respond to the CPHIA, why it's so different. I know Professor Shisama will have answer and Dr. Somi. The CPHIA first is coming in the context of decrease of ODA. Now negotiating, talking about our sovereignty, how we can start to provide funding to make sure that Africa is out of dependency. It will also be different because we have a huge increase of outbreaks. that is opening the door if we don't pay attention to a pandemic. And it will also be different because we are talking about the global health reform, the reform of the architecture of the global health. And then all of these discussions that we have in many fora will have that in Durban to see and to show that this 2025 CPHIA was so different from others. Maybe my colleagues who are attending with me will also want to say a few words on why CPHIA 2025 is different.
Okay, maybe I can just say something that this particular CPHIA 2025 is uniquely positioned, just to influence global health policy, because it's going to showcase African-driven innovations through plenary sessions and official side events, ensuring that Africa's health agenda is amplified beyond the conference so that it can shape decision-making at global forums. So I think that's why it's so different. Thank you.
Thank you, Prof. Dr. Msomi?
Thank you. Thank you, TJ. I think in his opening address, the TJ mentioned something along the lines of local manufacturing as well as employment and the other levers of industrialization. At least in the minds of BioAfrica, this conference or convention will bring together all the stakeholders who have the levers to the different verticals that we need towards pushing for innovation-led industrialization. And I think I want to underline industrialization. When we speak of manufacturing in the continent, we have to start speaking about manufacturing using innovation that is de novo, that's developed in the continent, because that's the only way you get to address local solutions. And I think this is one conference where that part of the puzzle in the value chain, where you have upstream innovation that is led and defined by Africans based on the challenges about pharmaceuticals, for example, that address problems, whether it's Ebola or it's chikungunya, that have two small markets for global North big pharmaceuticals, and you start building, because that's the only way you will build an indigenous, an African indigenous pharmaceutical industry at an industrial scale, instead of the same old technology transfer where these things have been discovered elsewhere. And certainly from where we sit, this is not a short-term program or project, it's a generational change. So I see the forthcoming conference as a generational change to tilt the balance towards having the ability to integrate upstream innovation with industrialization. If you look at the profile of the industrial giants in pharma in the continent, you just have to look at them and figure out where they get their technologies, the same old technology transfer. It's the time to change the game, and the technology and the innovation to be originated from the continent itself. And that's, in our view, from a BioAfrica perspective, and with the startups that we are starting to see in the continent, because this is how most industries are developed, via the startups and via the talent of Africans by Africans. I think that is where, for me, we see that this will be an integration exercise between the various pieces of the puzzle, from policy to governmental to startups, and hopefully over a period of time, big industry that is indigenous in the continent. Thank you.
Thank you, Dr. Msomi. Let's take the last question. We have Zila. Zila is from the Cameroon Post. Zila, if you can hear us, you have the floor. Zila, can you hear us?
Oui, oui, bonjour.
Bonjour.
Allô, vous m'écoutez?
Yes.
D'accord. D'accord, merci. Moi, c'est Zile Mgrambete. Je suis journaliste pour le Njam Post. Ma question s'adresse au DG de CDC Africa. J'aimerais savoir si l'intelligence artificielle et les innovations numériques sont au cœur de la transformation sanitaire mondiale et comment CPHIA 2025 compte-t-elle encourager leur adoption éthique et équitable en Afrique? Et la seconde question est de savoir, est-ce que les boursiers CPHIA 2023 peuvent s'inscrire comme délégués pour prendre part à cette édition de CPHIA à Durban en Afrique du Sud? Merci bien.
Thank you. DG?
Thank you, Margaret. I know you were waiting for translation. Je vais répondre en français pour notre ami. Nous ne pouvons pas, en Afrique, nous passer de l'intelligence artificielle, puisque il y a beaucoup de bénéfices. Pouvez-vous vous imaginer être dans un coin reculé, dans un village, et bénéficier des consultations par un médecin qui est dans la capitale, grâce à la connectivité, à l'intelligence artificielle. Cela va sauver des vies, cela va faire une grande différence. Mais l'intelligence artificielle n'est pas sans risque. Il y a des risques de cybersécurité, les risques de fraude, des détournements des données. Et donc, chaque pays met en place des politiques pour garantir l'utilisation sécurisée de l'intelligence artificielle. Au niveau continental, nous avons aussi des directives dans ce sens pour nous assurer que nous tirons le plus des bénéfices de l'intelligence artificielle que les côtés négatifs que l'on voit dans certains moments. Je vais laisser Professeur Chisana et puis notre collègue pour répondre à la question sur les CPHIA par rapport aux inscriptions telles que notre collègue Zila l'a demandé. Over to you.
I'll ask Dr. Chewe to address that issue because it's a logistical issue. Dr. Chewe?
I'm not sure if she's with us. Maybe Dr. Elvis?
Yeah, thank you very much, Margaret. Je vais répondre en français. Par rapport aux inscriptions, nous avons 4 différentes catégories sur la page d'inscription. Il y a la catégorie qui est réservée aux nationaux africains. Il y a la catégorie des participants internationaux qui ne sont pas d'un pays africain. Et il y a la catégorie des étudiants ainsi que la catégorie des délégués. La catégorie des délégués est réservée pour des groupes particuliers qui seront entièrement pris en charge par Africa CDC et cela inclut les personnes dont les abstracts ont été acceptés pour une présentation orale. Il y a aussi des personnes qui font partie du comité scientifique et bien d'autres. Donc, pour pouvoir appartenir à cette catégorie, vous devez recevoir un lien qui va vous permettre de vous inscrire sur cette catégorie. Hormis cela, vous devez choisir la catégorie qui décrit très bien votre type de participation. Je vous remercie.
Thank you very much, Dr. Elvis. Dr. Chewe, do you have anything to add?
I think Elvis has covered everything. Thank you, Margaret.
Thank you very much. So we take the last question. I'm told we have let's see. Right. Babloki is an African daily, from the Africa Daily Press in Botswana. The question is, one question is to Dr. Kaseya, and the other question is for Dr. Msomi. So Dr. Kaseya, in light of Africa's experience managing COVID-19 and the recent Mpox outbreaks, how has Africa CDC foresight policy evolved to better anticipate, prevent, and respond to emerging public health threats? This is in reflection to the first three international conferences. What have been the key takeaways and lessons learned that are now informing Africa CDC's strategy and priorities for the continent's health security? There's those two questions for you, DG.
Yeah, believe me, I will answer, but I know Professor Olive will say more about it. I say that because we have a champion, the champion for pandemic preparedness and response. This is President Ramaphosa. Is well articulated when we talk about how to ensure that African countries can better prevent and respond to outbreaks. There are a number of steps that we need to consider when we want to ensure that health security is secured at country level. We need to make sure we have, and these are some lessons that we learned from Africa CDC, from COVID. We need to have a strong, not only country approach, but also regional approach, because an outbreak can spread quickly. We have cases, Mpox, cholera, Marburg in Africa recently. This regional approach will complement the national approach. And when we talk about the national approach, it's mostly about making sure that you have in place strong surveillance system, lab network, laboratory network. Then you have also support from communities, because in our context, we are deploying community health workers to support for the surveillance and the detection of diseases or outbreaks. Then we need a strong coordination mechanism that we're also discussing the financing issue and others to ensure that all partners are working in, not in isolation, but they are working together to make the continent moving. I think these are a few areas. In addition, yes, we can give others that can be mostly around local manufacturing, about health workforce, about financing. We discussed that. But these are critical areas to ensure that countries will be ready. And if we have an outbreak, they can detect that early and respond without spreading to other countries. I will stop there.
Thank you, DG. Prof?
Okay. President Ramaphosa had been and continues to be a champion, for pandemic preparedness at the African Union. And he has often tabled a number of recommendations to the heads of state, requesting them to take action with regard to public health, especially that as a leader in this particular area, he was guided very much by the new public health order, which has been promoted strongly by Africa CDC. On Mpox, for example, he recommended to secure additional commitments for Mpox when it was at its highest, and then appealed for pledges to be translated into commitments and eventually disbursements. So he was very specific in terms of what it is that needed to be done. Furthermore, he pushed for domestic financing, requiring immediate operationalization and replenishment of the Africa Epidemic Fund, which is supposed to be implemented. He also continued to support Africa CDC to secure implementing entity status in the pandemic fund. And indeed, they do have a position in the pandemic fund. Also, he supported the Continental Secretariat to ensure monitoring and accountability of the Lusaka agenda that would ensure that those who were contributing resources to Africa should contribute resources on the basis of priorities and actions that are to be taken by Africans rather than being imposed, externally. And also, he argued very strongly for increasing investments in establishing national public health institutes in every member state so that they can be able to have a coordination platform, which would be led by Africa CDC. He was strong in the area of regional manufacturing and equitable access to medical countermeasures, calling for the Global Fund, UNICEF, and PEPFAR, for example, when PEPFAR was still active, to procure 30% of health products destined for African market from African manufacturers, because we do have African manufacturers currently. And we wanted to make sure that resources are coming to them so that at the end of the day, they can be able to make a difference. And of course, there were quite a number of other things that he did, pushing for adoption of the Health Workforce Compact. So all of these things, these recommendations were supported, and they formed the decision of the African Union. So they are tracking them to see whether they are being implemented or not. At every AU meeting, they have an opportunity to give a report on progress with regard to some of these issues. Thank you.
Thank you very much, Prof. Shisana. And with that, we have come to the end of the briefing for today. I will now hand over the floor, first of all, to Dr. Msomi for your closing remarks, and then Professor Shisana, and then DG. Over to you, Dr. Msomi.
In closing, I would like to reiterate our gratitude as Africa Bio, which is a non-governmental stakeholder formation, for the opportunity to start engaging with the governmental part of the equation. That's the number one thing that I'd like to raise. The second one is that this is not a short race. It's a long, as I said earlier on, generational race that would define what will happen in the next generation. I'm fortunate that I started biotechnology in the 80s, and we see how biotechnology has come to dominate healthcare and agriculture in our present time, and that we would be making a mistake if we don't invest in the pillars of an emerging industry for Africa. It's no longer emerging in the world. It defines the inequities that we speak about. It will have to define the future of health security and food security in the continent. And I think this is a good start, where you bring in different partners. Also, to include a proper analysis of what are the drivers of industrialization. That a lot of the drivers of inequality have a lot to do with industrialization, and that we ignore innovation as a main driver of industrialization at our peril as a continent. It's very, very important. What I would appeal, because I never hear it when we're having these discussions, I never hear the discussion about how do we define innovation? How do we define the models of innovation that apply to Africa? Not just Global South, because Global South is a generic term. I've seen during the HIV problem, the HIV pandemic or epidemic, how the trip waivers favor the particular continent. And I would like to appeal for political courage from our African leaders to look at what went wrong there, because despite the fact that we've pushed back the challenges of HIV/AIDS, we've not really industrialized our pharmaceutical and healthcare industry as a result of those WTO trip waivers. And that's the main thing we would like to say. Going forward, it's good to have the conversations and the dialogues that we're having, but we have to now start integrating it across all the levers of society, from intellectual capital, our youth, because it's the future, it's their future that we're drafting, and across policies and the like industrialization. I'm quite happy that the DG started with indicating that the solution has to be balanced or counterbalanced with what industrialization and economic development brings to the table, as opposed to just having public health as a political and a social driver or lever. It isn't. It is driven by industrialization and the economics of it as well. Thank you.
Thank you very much, Prof.
Okay, this has been a very useful briefing, and I hope you feel the same way as I do, that it has been very useful. You can ask questions as journalists to say, how do you engage with this particular conference? You are encouraged to attend the open sessions, interview some key speakers, and report on the innovations and policy shifts that are emerging from the conference. There will be daily briefings, press kits, and media access to expert panels. So please do make use of those. When you are there, take them and share. And also, you should take away this message that Africa is not waiting for solutions. It is building them. CPHIA 2025 is a turning point. It's about reclaiming our narrative, scaling what works, and investing in the future where African health systems are resilient, self-reliant, and ready to meet tomorrow's challenges. So that is a message I think you may want to communicate. Thank you so much.
Thank you, Prof. Back to you, Dr. Kaseya.
Thank you so much. I think it was a wonderful moment discussing with journalists about CPHIA 2025. We will all agree that the context of the continent today will lead for the CPHIA to be mostly focusing on the health sovereignty agenda. When we talk about health sovereignty, we talk about finance, we discussed that. We talk about local manufacturing, we discussed that. We talk about the digital agenda. We talk about the reform of the global health architecture. We talk about all of these pillars, including pandemic preparedness and response, that will make our continent safe and prosperous. And we believe this meeting, thanks to your support, journalists, to share broadly the information, and you got also some messages from our colleagues about the visa issue, about the way the South African government, BioAfrica, and with support from Professor Chisana, who is the co-chair, and other colleagues like Professor Chewe and Elvis and so others, you can feel how we are so excited to have this moment. We hope you can help us to share broadly this information that can help to have more Africans coming to feed the discussion toward the G20 meeting that will take place a few days after this one. Thank you so much, Margaret, for the opportunity.
Thank you very much. See you in Durban.
Recording